Okay, next on the list, Intellihealth. There are your slides. Let's give Sam a second. There you go. And Catherine, the stage is yours. Take it away.
Sorry, thank you. Can I start over at the time?
Yeah, of
Thank you.
course. Go ahead.
Yeah, absolutely.
So thank you, Kendra. I'm Dr. Catherine Saunders, co-founder and senior medical officer of Intellihealth, which is a healthcare technology company focused on addressing the obesity epidemic at scale. I'm thrilled to be participating as all of our co-founders are actually local in New Canaan and in Greenwich. I'm going to start with the question, why is losing weight so hard? Because excess weight is actually a misunderstood medical condition that's way more complicated than calories in, calories out, and strategies like eat less, exercise more are not sufficient for most people. This is a topic that I've dedicated my career to. During my residency in internal medicine at Weill Cornell, I prescribed multiple medications to most of my patients to treat their high blood pressure, heart disease, diabetes, and other weight-related medical problems. But I didn't have the tools to address the underlying cause of most of their health problems, their overweight or obesity. So after residency, I became the first obesity medicine fellow at Weill Cornell's Comprehensive Weight Control Center, one of the leading academic weight centers in the world. Under Dr. Louis Arouni's guidance, I learned how to help patients actually lose weight and keep it off long term. A few years ago, we started Intellihealth, and our mission is to scale and democratize access to comprehensive treatment of overweight and obesity. Next slide, please. So let's take a look at the problem. 74% of the country has overweight or obesity, and this number is projected to increase to 80% by 2030 and probably sooner than that because of the pandemic, unfortunately. Currently, there's minimal education in medical training on what obesity is and how to treat it. This is why most health professionals don't address their patients' weight and don't know how to help them lose weight. I'm one of fewer than 100 fellowship-trained obesity medicine physicians in the country, compared to a disease like diabetes, where 86% of patients are treated according to guidelines. That number is less than 2% for the disease of obesity. Next slide, please. This is the problem that we're addressing at our weight center and the problem that we're solving at Intellihealth. Our medical model helps patients who've repeatedly failed traditional weight loss programs lose 2 to 3 times more weight and, more importantly, sustain that weight loss long term. We've developed algorithms that generate personalized treatment recommendations for each patient, and our algorithms will optimize recommendations as we grow and improve weight loss, health outcomes, and cost savings. Next slide, please. I want to highlight that the majority of the providers at our weight center and the majority of our team at Intellihealth are women. One of our recent awards was a Women Innovators Investment Competition, a joint competition between Weill Cornell's BioVenture eLab and Amplify Her Ventures, the VC
30 seconds
on women. Next slide, please. In November, researchers at Brigham and Women's Hospital in Boston published a study in JAMA demonstrating the efficacy of our behavioral program in a population health setting, and many other publications and outlets have also taken notice of our approach. Next slide, please. In closing, I'd like to highlight a few of our customers on this slide, and thank you for having me. I'm happy to answer questions.
Thank you. Catherine, that was fantastic. Intriguing. Okay, Q&A, 4 minutes. Marie.
Go ahead, Aileen.
Hi, maybe I missed it, Catherine, but what is the price, and are you working with insurances, and how will that work?
Sure. So the kind of care that we deliver is covered by insurance. So all of the providers at our center take insurance. The price for the platform itself is a SaaS model, so it's per patient per month, and it generally depends on how many patients institutions or customers have, but it's not so much. It's like $7 to $13 per patient per month.
Renee?
So can you talk a little bit about usage? Like, I understand the results that you're getting. So like, if I'm a patient, how do I use it? And as a physician, how do I use it?
Sure, that's a great question. So providers who are even board certified in obesity medicine tend to need a bit more hand-holding to actually provide obesity care. So when we were in person, we would have multiple providers from around the country shadowing us all the time. I rarely saw a patient without, 1, 2, or 3 people following me. Now we're not able to do that in the same way. We've found that, by the medication decision support tools, the customized recommendations that we have on the provider side and all the education, that providers are very comfortable practicing the kind of medicine we do. And then on the patient side, it's everything that they would get with, any behavioral intervention like a NOOM or something like that, but basically a medicalized version of that to go along with the medical treatment that we practice.
Go ahead, Fran.
Yeah, I love to just follow up on that a little bit. So if I'm a patient, it sounds like there's an algorithm that's creating this personalized plan for me. But then is there an obesity expert that's also looking at it and modifying it? So it's kind of like you're getting both the technology and the okay. So
Exactly. Yes, Fran, yes, exactly. So for somebody like me, I know how to do this, so it's not as helpful. I'm not the target audience, but for any healthcare provider who has a medical background is interested in doing what we do, because the market is humongous. It's 74% of this country, and obesity affects basically every single field of medicine. So there's tremendous interest, but people don't know how to do it. So we basically give them, the tools that they need. Basically, a patient fills out a few questionnaires when they sign in. And based on those questionnaires, we identify every contributor to weight gain and every barrier to weight loss. And this is what I do in my initial exam when I see a patient. And so I've written algorithms basically that, based on those questionnaires, give personalized recommendations to the patient and personalized recommendations to the provider to help that patient. For example, your patient's at high risk of sleep apnea, order a sleep study or something like that.
I have a question. Oh, did you want to go, Eileen?
No, go ahead. Go ahead.
So I love that. It's interesting you're going through the provider side, right? But have you thought about like just going consumer side too? Because would you think consumers would be interested in, I just want the same thing?
Yes, so we've had a lot of requests actually to just provide the care ourselves, and we have a model where we're working actually with the Electrical Healthcare or the Electrical Workers Union in Queens. So one of our providers from our weight center, and actually two of our providers now provide care directly to them. So we are standing up our own medical service organization, and we'll use that as a model to expand further.
Just talking about competitors, you mentioned Noom as one of the competitors. Are you worried about anything else? Are there
No,
any
so
other
Noom-
competitors? So
just
Noom
to
doesn't have the
clarify.
medical staff, but like you said with the electrical providers, have you used this on people, and are you studying the results and stuff?
Yeah. So we published the results of our previous predecessor platform with my patients in my first 6 months of practice about 5 years ago. We also had a JAMA study a few months ago that was done by researchers at Brigham and Women's in Boston, looking at our predecessor company. So we do have a lot of data, and actually there's no real competitor because nobody else has exactly what we have.
Thank you so much, Catherine.
Thank you.